Now for more, we welcome Dr Maurit Beeri, the Director General at the Arlene Children's Rehabilitation Hospital, joining us from Jerusalem. Dr Beeri, thank you so much for your time. So plans are in place to accommodate this possible increase in COVID cases involving children. What is your assessment of the current spread? How worried are you about the impact on children in the country right now?
I'm truly extremely worried. I'm not worried because this is a specifically dangerous variant. I'm just worried because the sheer number of cases that we're seeing now means that there are going to be more complications, more children suffering from acute problems, but also I am very much concerned about the long COVID cases, which we know we will only see in a few months. And there is no way to tell which kid will eventually develop these complications.
So give us an idea of exactly how your hospital is involved. I understand that you are assessing cases and then sending patients on to other hospitals. Your understanding of how well equipped all these facilities are to deal with this potential increase in cases?
Well, we know that these children are not only susceptible to the disease, but to spreading the disease very quickly. And children don't keep social distancing. And it's difficult, especially for our kind of children with special needs, to wear masks. So any given case could potentially endanger other children. So we're very careful. We test the children. We send home anybody who is suspect. And we've had many cases where children were positive. We've also had cases where staff are positive, and we've had to send children into back home and stop the treatment because we couldn't keep caring for them. And that is also a danger. If a child needs treatment and cannot access it because they're in quarantine or they're sick, that's an issue by itself. We've had to transfer children to intensive care units. We've had to transfer children back home, and it is disruptive. And the longer this will last and the more people that will be involved, the more we will see that this endangers the health of children in general.
So it's very difficult to assess at this stage because so many of the experts have said that this is really still early days in this pandemic, but many parents have been hesitant to get their children vaccinated. What message do you have for parents who'll be listening to your concerns right now, worried about the spread of COVID amongst young people? What should they be doing?
I would like to urge all parents listening now to go, and if their children are eligible, to vaccinate them without hesitation. Not because vaccines are without any risk, but because all the data that we have from 2 years on means that the risk from the vaccines are very, very small compared to the risks from the disease itself. And may I remind everybody that chickenpox, we used to suffer chickenpox as children, and no one thought that a vaccine needed to be given because it was an easy childhood disease, but we had children dying from chickenpox, from complications, just because of the sheer number of children who would get it. Now, COVID is more dangerous and more disruptive, and if you are giving your children the chickenpox vaccine, there's no reason why not to protect your child from this vaccine, and it isn't any more dangerous than other vaccines at all.
Doctor, many children are sitting in quarantine in this country right now. Some of them are sick. Some have been in contact with COVID carriers. Is it too early to assess the extent of the psychological impact on young people having to stay in isolation, in some cases for 10 days, in some cases for 14? Your thoughts?
Well, we know by now that we have enough data to show that there is an effect on children's well-being, on their physical and their mental health, on their social abilities, on their skills in school. We know that the long-term effect of this whole period are going to be with us for a very long time. So we should really put all efforts into shortening the disruption in children's lives, getting them back to schools, to normal schedules, to spending time with their friends, to being children, because this ongoing situation cannot become a chronic issue. We have to get it over, and the only way to get it over is to vaccinate and make sure that we stay healthy.
Thank you so much, and we wish you all the very best with your work and with your team as well. Dr Maurit Beeri, the Director General at the Arlene Children's Rehabilitation Hospital, speaking to us from Jerusalem. Thank you so much for your time. Be well.
Thank you.